Hi, welcome to Gut Feeling. I am Laura Hernández. Hi, Dr. Snyder.
Hi, Laura.
I have a very special guest, and I want to present him first. I want to tell you a little bit about him because we can talk a lot about his curriculum. He's been in practice for 48 years. That's the first thing you need to know. And he has a doctorate in chiropractic medicine, degrees in both human biology and bionutrition, and board certification in homeopathic medicine. And he has other certifications in various forms of alternative medicine, including certification as an instructor in NAET for over 20 years. And you're going to be wondering, what is NAET? Well, I'm going to leave Dr. Snyder here, who is the expert, to tell us about what is it. And I'll tell you later my experience because I'm also a patient of Dr. Snyder. Welcome again.
Yes, ma'am.
Tell us.
So, I probably 30 years ago started recognizing that many of my patients were reacting to food, even the good food that I always recommend.
Organic or
Organic, yeah, protein, vegetables.
Whole foods.
Yeah, whole foods. And as I researched that, I came across research indicating that there's different types of allergies. And most of us think of allergy as hay fever or bite into strawberries, break out in hives. And that is your type 1 immediate mediated allergy. And that's what your allergist will deal with shots and various ways.
the obvious.
Not very effective, but just trying to treat the symptoms. However, it's interesting that we have found that the majority of allergies are in a category that we call delayed onset allergies, affecting one up to 72 hours after they come in contact with it. So these are more hidden allergies. Often we refer to them as hypersensitivities instead of allergy, just to distinguish. But what's interesting about this is once this occurs, once the body misfires, if you will, the immune system, and boom, reacts to something it shouldn't, which is what an allergy is, overreaction. Once that occurs on this delayed onset level, it can affect any organ, any system in the body. So I was amazed at, along the path, finding out that so many of the chronic conditions that all of us suffer with and that fill doctors' offices every day can actually be caused by this delayed onset allergy. And at best, most people are just trying to treat the symptoms.
When you say delay, that's the tricky part. It means that maybe you ate something like an apple that it's healthy, right? It can happen with any food, but let's say an apple. I ate an apple, and 2 days later, I start having hives or itchiness in my body or feeling in any other way. Maybe I feel too tired or it changes my mood what is it that you mean by that?
Well, again, this type of delayed onset allergy can affect any organ, any system in the body. So, and it can affect one physically, mentally, and emotionally. So, what I mean is that by delayed onset is that, yeah, the reaction that presents, and it usually is not hives or necessarily skin reactions that you would typically associate with allergy. It can be, and that responds well also.
Give me
But-
examples. Brain
oh,
fog. What can
yeah,
happen?
Yeah. Brain fog, constipation.
Okay. Yes.
Yeah, once the body reacts to the food, it doesn't digest, absorb, and metabolize it properly. Headaches are common issues.
And
But-
people don't think that's an allergy, right?
No,
They don't even relate it.
Yeah, and most doctors don't. And so, again, the medical profession ends up just trying to appease the patient by treating the symptoms with some type of prescription medication generally that, of course, carries side effects and at best just reduces the symptoms, but never fixing the problem.
It's not going to the root of the problem.
Exactly. So once I started understanding this and searching for better ways to communicate with the body, get feedback on that, that's when I came across the NAET research, which originated out in California with Dr. Devi Namboodrapad. And so it's N for Namboodrapad, A, allergy, E, elimination, T, technique. So essentially we've learned to apply physics to medicine by the understanding that matter is energy. Everything is energy, okay? Nothing is solid. It's made up of moving particles, molecules. Everything is. We are. So we have learned ways to energetically communicate with the body and not only get feedback from a diagnostic standpoint, but also to be able to go back in and fix the glitches, so to speak, to actually do some reprogramming through the nervous system and through the acupuncture meridians. I'm not an acupuncturist, don't use needles, but those are the two systems that control the body and allow us to go in, communicate, and reprogram. Basically, this type of allergy is, in computer terminology, is a glitch. And you know how glitches are.
Yeah, exactly.
Yeah.
I am a patient of yours for a few years now, and sometimes I try to explain other people what is it that you do to cure my allergies, because we are not treating them with medication. We are curing them. We're going to the root of the problem. And I've been allergic since I was born. And I get allergies. Everything gives me allergies. And in many ways, like you said, my own sweat, let's put it that way. That's something that I was amazed by it the first time. I just understood, like, oh my God, every time I sweat, I get hives, or I start getting pimples, or I don't know. It was so weird. And then understanding that it was my body reacting to my own sweat, it was incredible. And in the past, I tried everything that the doctors told me. Medications, I tried the injections, everything was horrible on my body. It didn't feel good. I didn't feel like it was doing anything. Yes, the symptoms sometimes, went away, but not to feel good. I understand that if you have a huge allergy of something and your throat is closing and your eyes are swollen, you have to go to the emergency room and treat it immediately, because that's a life-threatening allergy. I understand that. I've been there. I got it. But it's not going to help you in the long term. Yes, it's going to help you to stay alive at that moment, but not cure you and not have a quality of life. And that's the thing I was missing, quality of life.
Well, it's important to stay alive.
Yes, first of all. And then we'll go and try to fix the problem, the root of the problem, right?
Well, exactly. And that, unfortunately, that's where medicine is kind of failing, because they don't ever really look for the cause. They are just trained to treat symptoms. And it can be life-saving, as you say, but the research is showing that 80 to 90% of the reactions that we have are not immediate mediated allergies. Everybody knows if they bite into a strawberry and break out in hives, they ought to stay away from strawberries. But they don't realize that the foods that their body sees most often is what the body is inclined to react to. So egg, milk, wheat, yeast, corn, soy, sugar, salt.
Everything.
Yeah. And
Causing inflammation,
well,
right? Causes inflammation.
it's an inflammatory response by the body, but it can demonstrate by depression. It can demonstrate by headache. It can demonstrate by otitis media. The primary cause of that in kids is milk allergy. So the important thing is not to just identify it. That's where I started. I would find ways of testing the body and finding what it was hypersensitive to and saying, okay, here's your list. Read it and weep. Stay away from them.
Yeah,
and,
stay away from everything then, right? Some people,
it
like
was,
me, you would stay away from everything. The only thing you can drink is water.
It was very, very difficult, but people would go to that extreme because of the tremendous relief they felt for their various health conditions.
Exactly.
So being able to go in and fix the glitch, not just cover it up or stay away from it, has been a godsend, because it truly allows people to come back and to full and total health and eating.
And not being afraid when they are going to eat.
Exactly.
I was afraid. Every time I started eating, I was afraid because something was going to happen. And I couldn't do anything about it.
Yeah, and it isn't just, there's bad food that's bad for everybody.
Oh, yeah.
You know,
Yeah.
Too much sugar,
Processed food.
sugar, too much salt, too much fried foods. Everybody should minimize that. But this type of hypersensitivity to a food doesn't distinguish between junk food or organic.
I remember the first time I saw you, I told you, yeah, but I understand what you're saying, because, of course, I came to you. It was a leap of faith, right? Somebody referred me to you, a colleague, and it was like, I don't get it. I don't understand anything, but I'm so desperate that I'm going to try anything. So let's go and see. And I remembered saying to you, yeah, but I eat organic. Everything I eat is organic. I don't eat this, I don't eat that, I don't blah, 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 blah. And you were trying to explain me that it doesn't matter. I didn't get it until, I don't know, until a few treatments, until we did a few treatments. Then I was starting like, oh my God, is this real? It couldn't be, nobody will believe me. When I was talking to people about it, people look at me like this, like, what is she talking about?
When I lecture doctors,
Is she talking about a witch doctor? What is she talking about?
it goes right over their head. So
Now I love telling people and looking at their faces and smiling, because I'm saying like, well, you're having a lot of allergies, a lot of hypersensitivity, a lot of issues, but you're looking at me like I'm the crazy one. So it's okay, fine. What can I do? So now I feel proud of being able to tell people without fear, and proud of of having that leap of faith that changed my life.
You know, if you were on the top floor of a building that was on fire and you were exiting, knocking on doors, trying to help everybody you could on your way out, if somebody comes out and says, I don't see any fire, I don't smell any smoke, you going to stand there and argue with them, or are you going to help the ones that want to be helped?
Exactly. You'll say, it's okay. You just stay there. I see the fire and I see the smoke. But it's very interesting how many lives you have changed in 48 years.
Oh.
Lord.
It's been...
I become friends of some
It's so
patients
exciting.
because we see them all the time.
Of course.
But it's exciting for you and it's tiring. I know it's a tiring job. Because let me explain this to people that are listening and seeing this podcast. He is so good and so graceful that he allows patients to come with the bag of foods and things that they feel it's harming them, so he can test it. And I was the one, he came with 20 things to every appointment to try them all. Toothpaste, anything that I was touching, everything that it was in my house, like a drawer from a desk, something that was, I knew it was giving me allergy, or I was sneezing, or giving me a headache, or anything new. I just bring it on, and it looks ridiculous, but it's not. It's the most miraculous thing ever.
Well, that's the bottom line. And,
Yeah.
You can... Most people aren't aware, first of all, that anything going on with them has to do with the fact that they're eating something, or it can be anything you eat, drink, rub on your skin, or inhale.
Or smell, right?
Yeah. And so most people don't realize that that's what's causing so many of the issues that they have. I'm not saying it's the cause of everything, certainly, but the vast majority of the chronic issues that people deal with day in, day out, this is a primary factor. And it's just been amazing. I'm still amazed every day.
With what you do.
with what I'm able to do, what the changes that take place, the experience that patients have. My kids growing up would say, Dad, we can't go anywhere. And somebody comes up and says, your dad saved my life. But
That's the way it is.
But it changes people's lives for the better.
It definitely. And so people can understand a little bit better. For example, you go the first time, you make some tests, you determine the allergies, which for me it was pretty much everything. And then you started with the most simple thing. I think it was the egg, right?
Egg, yeah, we find that if you're reactive to egg, foods that are in everything and affect you in so many ways. Egg, for instance, is the very best source of protein. It's the
I love eggs.
only complete protein. When your body reacts to it in this manner, it not only affects when you eat egg, but it throws your protein metabolism off across the board, which affects every cell of the body. So it's the same way with dairy, the second one that we treat. It throws calcium metabolism off across the board. And when you start looking at how protein metabolism, the different effects it can have on the body, if that's not regulated properly, and calcium metabolism, you can go right down the line. Sugar metabolism, most people are reactive to sugar because it's in everything.
Exactly.
And people kind of like it.
Mm-hmm.
But
like me.
nah. So reprogramming the body
that's what you do. Once you decide, okay, today we're gonna clear, like you use the word, we're gonna
Use the
clear
word
you
clearing,
from
yeah.
the egg. Then after you do the procedure, if you want to explain it or not, but after you do it, it's 25 hours without touching. Not only eating, without touching the product or the food or whatever you're clearing the patient of.
Yeah, that's true. There are 12 major acupuncture vessels, and it takes a couple of hours for the body to process through each of the 12. 12 times 2 is 24, extra hour to play it safe. So while we're energetically reprogramming the body, it's important that you don't come in contact with what you are being treated for. If you do, that can blow the process, and patient comes back in, and we have to treat the same one again.
I haven't failed one. And I have done, I don't know how many. I can't count them.
Well,
One day you
yeah.
need to tell me how many we've done.
You know, I've had patients that leave my office and immediately meet friends for dinner and get halfway through dinner before it dawns on them, I'm eating exactly what I shouldn't. They get to be treated again. But let me just briefly touch on the fact that there's, and I'm simplifying this, but there's two energy fields that control the body. The nervous system, your brain, brainstem, spinal cord. Between each vertebral segment, you have nerve trunks emitting with bundles of nerves that innervate all the muscles and organs of the body. The other energy field are the acupuncture meridians, which the Chinese started working with some 3,000 years ago, and is a major part of the health system in most countries of the world. It's catching on here, but it's relatively unknown to most. But by non-invasively, through pressure point work along the spine, through stimulation, not needles on certain acupuncture points, you get the two systems reprogramming to whatever it is that we have the patient in contact with that they've tested positive for. I go through the treatment, takes a couple of minutes, and they stay in contact with it for a few minutes more. Then they go stay completely away from it for 25 hours. When they come back, first thing we do is test to make sure that everything went well. And usually it does. And then, boom, we go ahead and treat the next one. And once treated properly, and I've been an instructor in this for over 20 years, once you treat it properly, it should never come back to haunt you.
That's the most amazing part of it. That's why you change life. It's not something temporary. It's something forever. And I remember one thing that your wife told me the first day I came to the office too. I was in hives, my face. I have itchiness everywhere in my body, and I was with creams here and creams there, and it was like an anxious feeling. And she told me, what people don't understand is that having allergies is the same thing that being in pain. And it clicked immediately. It was like, exactly. That's the best way to express it, because you feel horrible and it comes from the inside, and maybe it's showing on the outside, but it's coming from the inside, and there's nothing you can do about it. And you can drink whatever you want, and maybe the symptoms will go away for a few hours, but it will come back because you will keep eating and you will keep touching things and you will keep smelling things. And what are you going to do? Stay in a capsule? So this is the most amazing thing I came across too. in my life. I told you this and colonics.
Oh,
And colonics.
Exactly.
The colonics came before, and they helped me to keep the toxic load in my body low, right? And that's why I keep the allergies, not that bad. But there was a time which I didn't have the colonics available for me all the time, and that's when it came. It did haunt me. Those allergies, they were horrible, and that's the moment I came to you. I found you, or you find me in the spiritual world. Let's put it that way.
Well, no question, your colonic hydrotherapy is an excellent procedure, and you're dealing with the end result, so to speak, of poor digestion, absorption, utilization, which is critical because if you're constipated, you become more toxic.
Exactly.
So the work that I do is to get you digesting, absorbing, metabolizing, but very importantly,
You need to release it.
it has to...
If not, it's going back again.
Exactly.
Back to every organ of your body.
Exactly.
So I just want to say, to finalize this podcast, because we should do like 10 more to keep talking about your experiences and lots of things that you have learned over the years. But thank you for taking the time. I know you don't do this much. So thank you for taking the time. And you retired and you came back from retirement, and I'm so happy to have you back.
Well, I love what I do, and I sure missed it. So
Can you give your phone number?
I'm back, 954-486-4000, Alternative Medicine Center.
That's perfect. And we are in Florida, but if somebody maybe reaches your office because they are in another state, maybe you can guide them to a place near them if there's someone doing it, right?
I've done that more times than I could count.
I can imagine. Same thing with me. Thank you. Thank you. Thank you. And thanks to the people that are listening. Gut feeling.
Thank you, Laura.